Hello, good afternoon all. Hope all of you are well. So today we will be discussing upon Trilokya Vijayavati. Let me just hope your presentation is visible. If any one of you can confirm, we are live on YouTube as well. So many doctors will be joining on YouTube, and we are doing on Zoom. So quickly, आप में से कोई भी एक confirm कर दें कि you are able to see the presentation. I think this is visible and I will start. So it is a very important session, Trilokya Vijayavati, because we have been got like people were requesting that इसके ऊपर session करें. Trilokya Vijayavati is a very common medicine now in the hemp space, in the hemp domain. Thank you for the confirmation. So काफी common है, like so many companies are manufacturing this now, marketing, people are prescribing, but somehow there are confusion, somehow there are issues, somehow there are doubts. Problem is companies are focused on sale. They don't bother about knowledge. They don't bother about uh, giving the exact information. They just focus on the sale, and for sale sometimes they overdo the things as well. So the overall marketing and sales communication should be not in that way that it overdoes, or like it like the indications, the dosage, and many confusions were there. So I request all of you to focus on this session. Sorry for some construction is going on, so some background noise is there. But hope I am audible and clear as far as this particular session was concerned. We thought to like request the construction people, but somehow there is some work is going on. तो त्रिलोक्य विजयवती एक आयुर्वेदिक औषधि है। हम सबको पता है उसके बारे में। मुख्य रूप से दर्द और सूजन के इलाज के लिए उपयोग की जाती है। विजया भांग के जो पत्ते हैं, और वंशलोचन जो बांस का तना, बेसिकली द मैरो ऑफ बैम्बू। वी ऑल नो अबाउट वंशलोचन, वी ऑल नो अबाउट विजया। एंड त्रिलोक्य मतलब तीनों लोगों को जीतने का इसके अंदर एक जो भाव इसके नाम में दिया गया है, उसका तात्पर्य यही है, उसका मीनिंग यही है कि दिस इज लाइक वन ऑफ द ड्रग ऑफ चॉइस और मेडिसिन इन टर्म्स ऑफ मैनेजिंग मैनी डिजीज इन ए वेरी इफेक्टिव मैनर। स्पेसिफिकली अगर हम इसके इंडिकेशंस को समझेंगे, सो वी विल अंडरस्टैंड दैट दिस इज एन एक्सीलेंट medicine, but for mild like aspects, not for the acute or the like severe pain, but for the mild to moderate, it is very good in terms of muscle pain, joint pain, headache, uh, back pain, inflammation, cramps. So if the overall like level is mild to moderate, it is an excellent medicine. It is in 125 mg, and some companies have 250 and 500 mg tablets as well. So in that way, it is an excellent medicine, and we can prescribe in the cases of all these indications. This can be also effective in mild insomnia, anxiety, and digestive issues as well due to the Vijaya in it. But specifically, when you talk about Tirokya Vijayavati, for muscular pain, neuropathic, joint pain, headache, back pain, inflammation, any kind of inflammation and cramps, especially in the menstrual cycle, we have seen it's a very good medicine when given in a proper dose with adequate advice and all. So you all can give to the patients. But yes, as I repeat, in the mild to moderate. But if you have cases of acute or severe, then you should go for extract medicines and the better potency medicines, or maybe the double strength, or maybe higher dose also. But sometimes the higher dose of Tirokya Vijayavati can cause gastritis as well. So that you need to understand. Composition, it's very simple. Vijaya 62.5 mg dried leaves, and Vanshlochana 62.5 mg. In some references, we have in Ayurveda, Trikatu, Trifla, or Guglu is also mentioned. Although companies are not preparing on those references, they are just having Vijaya and Vanshlochana. When you go to the various companies and see the formulations, so most of them have Vijaya and Vanshlochana in it. They don't have Trikatu, Trifla, and Guglu right now. But in our classical context or references, it is mentioned in these in Trilokya Vijayavati. In some references, Trikatu, Trifla, and Guglu is also mentioned. So maybe any company wants to launch, they can launch the Trilokya Vijayavati in with these formulations as well, because Trikatu Trifla will definitely help in terms of many other indications when be taken. And dosage is one tablet twice a day or as directed by the physician. So one tablet morning, evening, after meal we can give as far as the dosage is concerned. We can give more as well depending on the case to case basis upon body weight, age, and all. But at least this much dose is required. Then pathya is very important in Ayurveda. Recommendations, or maybe along with cow milk, cow ghee, or buttermilk, you can also give, or these can be taken. So it can be considered as anupan or as a pathya also, but it is recommended as far as Tilokya Vijayavati is concerned. And excessive spicy, cold, dry food, heavy to digest meals, exposure to dry and hot environment, all these should be avoided whenever we are administrating त्रिलोक्य विजयवती, because उष्ण वीर्य है, रुक्षता को बढ़ाएगा. All these aspects should be taken care of, and that's why cow ghee, cow milk, and buttermilk are suggestive to neutralize or to balance that ushna virya which is there in this particular medicine, particular tablet, that is Trilokya Vijayavati. So potential side effect, very important slide. See, ultimately when we are giving any medicine, any Ayurveda medicine, people think that it will not have side effect, but yes, it can. And due to Vijaya in it, so mild dizziness, blurred vision, dry mouth, especially when the person is taking first time in their life as far as the Trilokya Vijayavati or medical hemp or cannabis is concerned. So we need to understand there can be some potential side effects which we need to maybe avoid, and ensure that they are updated about that. So dizziness, blurred vision, dry mouth, constipation, vomiting, nausea, all these are potential side effects as far as Trilokia Vijayavati is concerned. So please make the patient aware about these side. First of all, you should understand why it is. Let me just quickly make you aware that dizziness, blurred vision, dry mouth, dizziness again, it's property of cannabis, because we are having Vijaya leaf powder in this. So mild dizziness due to the the active ingredients like THC in a very small quantity, it can cause dizziness and blurred vision. Ushnavirya again, dry mouth and constipation, and yes, it can be it can be a causative factor for vomiting and nausea as well. So these are some positive potential side effects, but not in all patients. And when you are giving after meal, maybe 20-25 minutes after meal, that not much will be there. So this is one aspect which you all should understand when we are prescribing to the patients. And contraindications are allergy, pregnancy, lactation, pediatric population, heart disease, and surgery. So in these aspects, please avoid as far as the Lokia Vijayavati is concerned. If somebody is allergic to this, definitely there are no information and data available. And in Ayurveda also, pregnancy and lactation we should avoid. Pediatric population, patients with heart disease, and surgery. So this is very important to understand as far as Lokia Vijayavati is concerned. So let me just go back and let me give you one by one perspective. So when we talk about muscle pain, joint pain, headache, back pain, inflammation, and cramp, what is the approach? See, on one side it can be an excellent painkiller. I am just going through the private practice mode when patient come to our clinic. So they ask that I am having pain, can you give me other treatment? So on one side we are trying to heal the root cause. So for example, let me quickly give you some case studies or some examples. So if there are cases of sandhivat, amvat, vatrak, so we will be definitely giving them standard of care. In terms of sandhivat, we all know what is the standard of care. For example, we are giving them Mahayogra Guglu. For Ambat, we are giving them Singnath Guglu. For Vatrak, we are giving them, for example, Keshor Guglu, or any other medicine which is there as per Ayurveda, and other medicines also as far as the standard of care is concerned. But if we are adding Trilokya Vijayavati into that regime or into that standard of care, then it will give them the pain relief from the day one. So many times initially when we started Ayurveda practice, unless or until you have a Panchkarma center, you are an Agni Karma expert, or you have certain other therapies or treatment procedures at your setup, you are not able to give them the pain relief from the day one just with the maybe any kind of medicine. Root cause healing will be there, and after some time the patients will be healed. But initially, when we are giving the standard of care, and if we are giving Trilokia Vijayavati or any other medicine of hemp or cannabis, which we have seen, the pain is relieved from the day one. So at least they are not taking the allopathic painkillers for that matter, and that is the first level or first like step that patients are very positive about Ayurveda treatment. So that is also applicable in other cases like joint pain, backache, inflammation, cramps. Cramps, for example, you are treating a case of dysmenorrhea. And in dysmenorrhea also, we have Ayurveda medicines, syrups, many Rajpravatani, many classical or proprietary medicines to manage those kind of cases. But when the patient is coming and on the first cycle, you are like making them ensure that their pain will be relieved and it will be at least lesser. So that confidence and that trust start building up in the patient. So these specifically these kind of medicines like the Lokia Vijayavati and other in medical cannabis and hemp have that potential to, and many doctors across the country are getting benefited due to this particular aspect. So we need to smartly use these medicines in our clinical practices, or definitely this is not a standalone treatment, I repeat, because again many companies are promoting it as a standalone treatment. Unethically they are selling without prescription, they are selling on the site, you can order directly. People are companies are generating fake prescriptions. So all these practices are wrong, unethical, and we should raise our voice against those companies. But as a doctor, as a Vaidya, as an Ayurveda doctor, we should understand that what exactly is the ethical way of practicing, because category is not wrong. Vijaya is being mentioned in our Vedas from last so many years. More than 200 formulations are there. So it's not incorrect, or it's not unethical, or it's not wrong to practice hemp or cannabis. It's just the unethical practices which you need to understand. And as a doctor, we need to also in infuse these medicines in our standard of care. Because on one side, I said that it will help you managing the pain. On other side, it is also Yogvahi, means Ashukari Yogvahi. It is mentioned, and Yogvahi specifically will enhance your another treatment or whatever treatment you are giving. If you are adding Trilokia Vijayavati, it will enhance your treatment, and it will also give you the efficacy in lesser duration. I repeat, if you are giving, for example, in OA, I have seen personally in our clinic that when you used to give prior to using Trilokia Vijayavati or any other medical cannabis or hemp medicine, it was taking us to around 8 to 10 months sometimes to get a optimum healing. But with these medicines of hemp, we are getting that in generally 4 to 6 months as well. So at least 2 to 3 months of reduction we have seen, and same applies for PCOD. Today, uterine fibroid case was there. In fact, 4 fibroids were there in that female, and 2 have been dissolved and 2 are remaining with lesser size. I will share the reports in our Instagram broadcast channel. Hope you have followed on Instagram, and you have also joined our broadcast channel, and we have recently started our subscription model as well. So if you are interested, please subscribe us, because in subscription you will be getting exclusive, like for example the video of this session and many other information you will be getting. And so my request to you is follow the principles in terms of adding these medicines into your standard of care, and you will see the results are better, results are faster, results are optimum as compared to the previous standard of care which you are using. So it is just an add-on to whatever the standard of care you are giving to any patient. It's not the replacement, by the way, right? So that approach we should have in all the cases. As I said, anxiety, stress, insomnia also are indications of Trilokia Vijayavati, but I have not mentioned intentionally here because there are better medicines available for insomnia, like a 50 mg or a 75 mg capsule can give can induce the sleep from the day one to the patient, and it is a very good you can say solution. People suffering from insomnia taking 2 3 sedatives also at a time, and for anxiety also we have many other herbs as well, by the way, for anxiety. So for this particular session and this particular medicine, I think these indications we should focus. And second is for the composition, I want to emphasize. So in market there are 125, 250 mg and 500 mg compositions are available in the form of DS. So for 125, 1 BD to 2 BD you can go. For 250 or 500, 1 BD or sometime 1 OD is also sufficient. So depending on again the case, age, patient, weight, what level of pain or what level of disease they have, you can edit or you can increase or decrease the dose. But you need to understand, and by the way, many companies are selling too expensive. It's not that, it's under 10 now, under 10 rupees per tablet now, as far as the Lokia Vijaya is concerned. So to the doctor, by the way, to the doctor price. So and MRP is also reduced to 12, 13 rupees, 14 rupees maximum, not more than that. So do not purchase overpriced medicines as far as this particular medicine is concerned, because that is also a very important aspect we need to understand, and accordingly we can add to the regime, to the treatment protocol which we are giving to the patients. Dosage we have already discussed. Then this is also we have discussed, and cow milk, cow ghee and buttermilk. I think these three things we always focus in our clinic as well. It's not about Thilokia Vijayavati, by the way. I will take a couple of minutes for this. See, ultimately people are confused. People are taking curd of those cases where they should not be. Buttermilk is a better option as compared to curd. People are not realizing that, and maybe a pseudo notion has been infused or ingested in the mind that yes, curd is healthy. Curd is healthy. I'm not saying curd is not healthy, but not in many aspects, and not as compared to buttermilk. Chaj and buttermilk is always better as compared to curd. So that we need to understand, and especially the milk and ghee also, if we are able to get off cow as far as the patients are concerned, then that is very much beneficial as compared to the buffalo or other source of milk and ghee are concerned. And in Ayurveda also, Gogrit and Godugd are always mentioned beneficial in many diseases, in many cases. So this particular aspect we should always counsel, and we should always highlight to our patients. And we have seen very good results when we have given Gogrit and Godugd to many patients suffering from several kind of disease. Like for example, in fact, in the cases of hyperlipidemia also, if you are giving medicines and along with a good quality Gogrit, it helps. It's not like it is increasing the cholesterol or triglyceride. No. So we all need good healthy categories of fats as well. So that is a very basic thing which we need to understand. In skin diseases also, in psoriasis, we are giving buttermilk. We are asking them to have a bath of buttermilk. Takradhara is mentioned in Ayurveda as far as psoriasis is concerned, and it is very helpful. In many skin diseases, I asked them to get a packet of simple charge, normal buttermilk without masala, that's sada wala, and put it in your mug and apply it to all over skin, eczemas, psoriasis, all these kind of aspects, and remain that for 4 5 minutes, and then take a bath with again an Ayurvedic soap which we are giving them. So, and it's a very good like healing property. Gogrit is having a very good healing property. So that you need to understand, and accordingly you need to recommend pathya and apathya as well. Apathya again, dry, spicy, heavy to digest meals will definitely cause issues. So that we need to avoid. And again, in potential side effects, see, dizziness and blurred vision, again, as I said, due to Vijaya, it can happen. So always start with a night dose to minimize and to avoid potential side effect. What is the strategy? That always start with the night dose and then increase the dose, or maybe start the day dose, or maybe start with lesser day dose. And so one tablet in morning and two tablets in night you can recommend if you have 125 mg, one tablet in night, and then after 2 3 days start the one tablet in morning if you have 250 or 500 mg, depending on the case. So always start with the night dose. People will get to use in 1 or 2 days, and then definitely this dizziness, blood vision, and other issues will not be there. And after starting, or maybe along with the starting of Lokia Vijayavati, any hemp or cannabis medicines when we are starting, so always have pitch shamak 1 or 2 solutions depending on their prakriti and vikriti, because pitta vardhak hai, so vat or kaf shamak hai, pit vardhak hai Vijaya. So whenever you are giving Vijaya or cannabis or hemp, always add some pit shamak solution in the treatment, so that this dry mouth, constipation, and all these issues will not be there, and the patients will be having lesser side effects. So this is one approach which you all can follow. And always remember these contraindications, because this is not advisable as per the international research is concerned, and many other aspects are there. So this was all. I thought to have a short